So my next, our next guest is on the conference board. He was here last year also, and he loves gadgets. And he's an optimist. He's an optimist as long as I know him. I know him, I think, Lucien, 50 years, something like that? Maybe even longer. We met each other at the Radboud University. He was of the Innovation Center, I was in the supervisory board. And he was so inspiring that you had to know, you had the feeling, I must be there. I have to embrace innovation. But I think there is some hesitation nowadays in his optimism. Maybe because of AI and what AI promises. So Lucien, take us with you. Are you still the optimist? Lucien Engelen.
Thank you very much. Thank you very much. I thought you said 50, but luckily it was 15. Thank you for that. So yeah, I've been accused many, many times of being a serial optimist, but to be honest, I'm also a bit fed up. And I'm fed up about all kinds of things that are happening in the realm of technology, not only in terms of nursing, but everything that's going on. And if you look a bit at what's happening in the past couple of days, weeks, you see that there's a tremendous push towards all the things that are possible with AI. And all the things that we can do, and all the diseases that we can solve, and all the things that you as a professional are able to do no longer, because something will come over and happen and help you. And I'm also fed up about all the trillionaires and the billionaires and all the ones that said, well, we'll invest 500 trillion, billion, I don't know, I lost track to be honest, about everything that they will pour into AI and everything is going to be solved and everything is going to be fine. Let me give you just one example of last week. This is the CEO of Oracle, Larry Ellison, announcing that 500 billion Stargate project. Have a look.
Thank you, Mr. President. One of the most exciting things we're working on, again, using the tools that Sam and Masa are providing, is a cancer vaccine. It's very interesting. It turns out, I'll be quick, all of our cancers, cancer tumors, little fragments of those tumors float around in your blood. So you can do early cancer detection. If you can do using AI, you can do early cancer detection with a blood test. And using AI to look at the blood test, you can find the cancers that are actually seriously threatening the person. So we can, again, cancer diagnosis using AI has the promise of just being a simple blood test. Then beyond that, once we gene sequence that cancer tumor, you can then vaccinate the person, design a vaccine for every individual person to vaccinate them against that cancer.
Great.
And you can.
Thank you very much. And I would love that would become a reality tomorrow. The thing that happened with all these press coverages is that patients are going to their GPs and say, I want to be in that trial. And the thing that happens is that the GP would say, well, that's not possible. And all of a sudden, the GP becomes a bad GP. And that's my problem with the current day and age, that there's so much promise, which I do like and I do trust, and also think that there's a lot of things will come out of that, but we need that human aspect. But what if that human aspect, one half of that, is no longer present? And it's been touched upon already by the former speakers, that in the way that we are looking right now, we have a system that I like to call, in my former presentation last year, a promise problem. We wait until somebody gets sick and then we act, which is fine, but we also need to be assured that this tremendous pressure on the shores of healthcare is coming increasingly into this new code black, that whenever this really kicks in, all of a sudden everything stops. And I do think that we forget what really makes health health. It's not about technology. It's not about money. It's all about behavior. It's about where were you born, about the social determinants of health. And that 6% that healthcare contributes, supports, sucks up 90% of the budget, as I last year showed. So somebody should go into the basement and close down the tap a bit more. More healthcare delivery is not the solution. More health is. And that's also where all of us come in. Not only technology, not only medicine, not only physicians. I really do think that we got 3 pillars to work on. One of that is, of course, personalized medicine. The second of all is personalized healthcare. Different topic. The first one is disease, the second one is the care. And then we have personalized health. And I think all of that can happen, but it's not a quick fix. And diving a bit more into that personalized medicine, I think, yes, sure enough, that is where AI comes to the mix. And it is not only big promises, it is going to help us tremendously. But first, at the efficiency level. Hopefully drilling down into those data pillars that also Abigail talked about, where the standardization is going to help us to make sense of all of the information that's in there, even the wrong information, as we discussed yesterday. That could really help. It's a new revolution, as we've seen about the industrial revolution, then came the internet, and now there's AI. And let me show you one brief video about the promise and also the opportunities that AI can entail. And this is a physician talking to one of the large language models. Just have a look.
Gemini, what am I pointing at now? What organ is this?
You're now pointing at the pancreas.
That's the computer.
Okay, and do you see anything abnormal on this scan?
Yes, there is a small amount of fluid around the spleen and the pancreas on the scan, which could be a sign of inflammation or injury.
And this goes on and on and on. The interesting thing is that we're now stepping up to this new era of AI, agentic AI, where small agents will go and collect data on behalf of you as a physician, nurse, patient, government even. And the interesting thing is that they will go around, and I think actually they will disrupt websites as we know them right now, web portals in healthcare as we know them right now, apps as we know them right now, because you as an individual, in the end, not tomorrow, but in the end will be able to utilize those kind of things. And the same thing will happen as happened during the first day and age when Apple launched the first app store. And I think there will be an app store for agents on behalf of you, and you as a patient or citizen are able to choose from that. Also to get all that data that's enclosed in all those silos that, based on the standardization that was talked about prior already, is getting more and more opened up. But we also know with AI, garbage in is garbage out. So the first thing that we need to do, and that was also part of the discussion yesterday, which was kind of boggled between EMRs and PHRs, is that we need to make sure that the right information is in there. And by the way, AI is not going to solve everything, to be honest. Second pillar is personalized healthcare. And that's where we need to make that shift from, at one end, resolving things that already have happened into making it a preventative opportunity in that. And that's also public health. But for many, many years, we as healthcare started to innovate on behalf of the patients. We tended to know what patients needed. We did not. When we started, for instance, in Radboud University Medical Center in 2010 with our Reshape Center to involve patients right from the get-go, human-centered design, we learned so much about the things that we didn't know. Small things that matter to our patients that we didn't were aware of, but help to adopt these things. And now in this current day, we see that patients are starting to innovate themselves with the technology that's out there. Crafting new patient journeys, where the majority of the patient journeys that we have now is not a patient journey, it's a journey of a patient in a hospital at one ward or one physician or one nurse. And Annemiek Vroom from the Stichting Icona always said, we need the journey of life. That's a patients-included journey. And that's where also we now see patients collecting data from their watches and everything else, and now being able to run their own research, as opposed to 1 times 100,000 patients included, it's 100 times NS1. And with the opportunity to create their own models in due time, they're also able to create new technology. For instance, like Dana Lu, as a patient with diabetes type 1, created her own artificial pancreas. And with the code, she uploaded it into GitHub and published it herself. So this is exactly also what Jeroen was telling, not only about nurses, but also patients are stepping into that realm. So the code is completely also uploaded. And yesterday I had the honor to be at the festivities of Abbott with the 10 years anniversary of the Freestyle Libre for patients with diabetes, being able to have a continuously glucose monitor. I think that's one of the first major implementations of mobile health at scale. Interesting is the last part. It's the personalized health part. With all the technologies that we see, often in healthcare always was and needed to be FDA approved, for instance, with all the big companies that are working in there, we now also see that these observational aspects also are kicking into the mix. But there's also another side. The other ones say, well, wait a minute, that's also our space. That's where we can work a bit into it, isn't it? So what you now see is very interesting. Could you put up the light a bit for a minute? Who of you has one of those aspects from one of those devices? So just have a look around, just how many people have of those earbuds. Are you aware that as of 6 weeks ago, you have an official certified hearing aid that you can utilize as opposed to $3,500 you need to pay for a hearing aid? You can start using these things with audiograms and stuff like that. It's not about this device for me. It's more like that's the things that we see happening now. And now Apple and Samsung are battling about the first blood pressure measurement in a watch. So this is going rapidly. And we need standardizations, as has been mentioned by the Ministry of Health, not only on the national scale, but also broader, of course, internationally. And that's where there's a lot of work already. Meanwhile, Apple and Samsung have platforms where you also can share many of your data. And that data model is shifting from historic data now into recent data, and then we're going into real-time data. With that, going from static to now predictalytics to prescriptalytics. So I started my healthcare career in ambulance services, and I will meet the day that somebody would knock on my door. I would open up. I see one of our ambulances and 2 former colleagues, and they say, hey guys, what's up? And one of them would say, well, we're fine. We're fine, yeah, we're here for the cardiac arrest. And I would say, there is no cardiac arrest over here. And one of them would look at his iPad and would say, take a seat, Lucien, in 1.22 seconds, that is going to be the case. So that's also prevention. And the WHO calculated that for every 25 cents, look at the impact that we can create for that in the broader sense. So when I take all these things into account, you also need to be aware of that it will take between 7 and 16 and 17 years before these things get implemented. And we're now at the verge of this new wave. The yellow path is the path that we're on. We know it's not sustainable anymore. We cannot cope with all the tremendous pressure that healthcare already faces and will face even more. We can wait until the blue line with all the signs and everything else has kicked in, and we should, but we also need to act now. We need to make sure that we understand with the tremendous speed from outside into healthcare, we also need to take that stake at the table. And I think that many of the technology is the hype, but the change, that's the one that's permanent. And I also think that we also need to be mindful of how these pathways look, where we see typically that, let me see if I can get this right. Well, let's not. Where some new technology comes up, and then it's going to be hyped, and then new science kicks in, and policy making, and education, and then gradually that comes in. Same was true for solar panels. Same was true for electrical vehicles. This is the Gartner hype cycle that we'll always need to face. What's happening now is that we as healthcare are on the menu of many billionaires, trillionaires, or whatever. And they think, well, that's a great market. And we've seen what's happening. If those 500 billion really come into fruition, they want to take a margin, so that will be 750 billion maybe. Who's going to pay for that? We. So I also think that we need to be in the mix and also to really engage in that. And that's been the case, luckily, with many physicians and others already. I think we as nurses can step up in that perspective as well. With technology that's going to help you at first, to create that administrative burden. Just imagine if we would be able to downgrade 10% of your administrative burden. I think we would have solved the whole nurses' shortages for the next couple of years. So that's also my call in that for it. We need you, nurses. And I'm particularly looking now at the nurses. Speak up. Not only wait and consume. Step up and come up, and your future is going to be built and crafted as we speak. And for that, we need nurses at the table in the broadest sense of the word, in all aspects. In standardization, has been mentioned by Abigail. In leadership, has been mentioned by Marjolein. And also in science and education, has been mentioned by Jeroen as well. And I think that's a great opportunity that we have right now. But it's also something that it is upon you. if you don't start to engage with us in that aspect, that train is going to go very, very fast further. We need a Greta for health, is one of the things that I often say. I have an opinion about Greta, don't get me wrong. But it's more like it has been put on the agenda that we need to work on the climate and we need to work on nurses as well. I still am baffled many, many times that there's many physicians at the table and administrators, and the nurse still has to work. So for that, please help us. And I'm grateful that also in this conference we were able to focus also on the nursing part for that. And whenever you want to continue the conversation with me afterwards, please follow me on LinkedIn. But also have a different mindset, as also was been mentioned by the late Steve Jobs, to think different. I'm wrapping up with a small video about innovation. You knew that penguins are the most innovative species in Earth. Just have a look at what happens when they are confronted with an innovation, and I'll do a little voice over to that. This is the innovation, that's the rope. The penguins is the social group. This is a social experiment, to be honest. So what you see happening is when they're confronted with the new innovation, some people start to look into what's that. Some others think, what the heck, that's great. Let's just go at the other side. Then you see the other ones at the other side of the rope say, what's that? Some people look the other way around, thinking tomorrow it might be gone. Just ignore it. But some others think, well, that's still interesting, and I like the opportunity to do things differently and also to take a real stance into that. That's also when you see that there is getting more and more noise at the right-hand side, where some people even think, well, we should make sure that they cannot cross the rope anymore. That's where the unions step up, you should not, so all these kind of things. And whenever there is again one or two crossing that line to the other side, where it's better, and where there's an opportunity, we see what's happening with the rest of the penguins. They say, well, let's grab some coffee. Thank you very much. And as Maria mentioned, I'm from the gadgets. So can I have a slide up, please? There's one more thing. And that's interesting to see also how gadgets, in the end of the day, really can help. Oh, so Tom, could you give me my backward? Just, yeah. Over here. No. Just give me a hand. Just give me a hand. Give me a hand. That's great. Come. You can do it. You can do it. Yeah, thank you very much. You can do it. So you're then the one more thing. Thank you very much. So this is Tom Softly. Just join me over here for a second. Okay. For the people who don't know, he's the CEO of ICT&health. He's the guy that we're all here. Yeah, and wanted to be here. He never wants to be on stage, so that's the reason why I tricked him a bit into it. Because typically at the end of the conference, he's at the exit, and he's way away from the podium, so we needed to make this trick. Tom, again, thank you very much. This Saturday, it's exactly 10 years ago that the first edition of ICT&health dropped in everybody's mailboxes. Yeah. And I remember clearly when you stepped into my office at Radboud University Medical Center to say, I want to launch a new magazine. And I thought, new magazine, again, another magazine. But you convinced me to not only to be your first cover story, but also to help you in getting that into the mix. There's not so many people that authentically, and I repeat that again, authentically are passionate about health and healthcare and really want to create partnerships with not only the healthcare, but also the rest of the industry. And I think you're one of the examples for that. In the meantime, it's not only that, and we all see the cover stories that are kicking in, but many people with boots on the ground contribute on a daily basis, not only on the magazine, but also on the web portal, combined with the editorial board. And I think that it's the intersection of ICT and health that really needed that voice. And then you again came with a weird idea, a bright idea, said, I want to create a conference. And I said, why another conference? And here we are, again in Maastricht, and the next one for 2027 is in the mix already. We're already working on bringing missions from Canada, people from Canada in the audience, and Australia and New Zealand as well, and other ones to the next edition. And I'm doing the talking because he doesn't want to talk. That's the thing, just so you know. And again, thank you very much for your leadership, for your vision, for your being authentic, sometimes being stubborn, which also helps. And also to make it possible that we also have one day particularly focused on nursing. It's not alone about nursing, but with that focus. Nurses cannot get away 3 days from their job. Let's be honest. So that's not a possibility. So thank you for that. Together with Maastricht UC, I think we've done a tremendous job. 375 now, next year 750, and Maria is bringing you the flowers. Let's have a standing ovation for Tom, please.
You tricked me.
Ja, wat ik doe.
Okay. Thank you.
Yeah.
So, Tom, how long, because you have to use my mic, how long are you going to bind this together?
Oh, many years.
Many years?
Many years.
Promise?
I promise.
Okay. Yeah. Thank you so much.
Thank you.